Hello, and welcome to episode 22 of Carry On with Carrie podcast. Today, I'm happy to have Jess Clement with us. She is an exercise physiologist and kinesiologist. She has 8 years in the healthcare field, working with pulmonary rehab, cardio rehab, and with primary care. Welcome.
Thanks so much for having me, Carrie.
Of course, it's so nice to meet you and have a chance to find out more about what you do.
Absolutely.
Can you just explain a little bit about what exercise physiology is and kinesiology for anybody that's not quite sure?
Yeah, absolutely. So with kinesiology, it's the study of human movement. So as a kinesiologist, we have a really broad scope of practice. We can work with people in terms of preventing injuries. We can work in terms of health promotion, any sort of chronic diseases. So it's a really cool field because it is so diverse. In terms of clinical exercise physiologists, you can think of it as a specialization or a complementary certification for kinesiologists. So it just allows me to work with people a little bit more closely in the field of a clinical setting. So, like you mentioned, in terms of pulmonary rehab, cardiac rehab, and just primary care.
Mm-hmm. How does this relate to mental health?
Yeah, so exercise is so important when it comes to mental health. There's been so much research recently, especially with COVID, in terms of just movement.
Mm-hmm.
So I guess I should differentiate between a couple of different terms. So when we're talking about physical activity, it's any movement that you do with your body. So that could be things like going upstairs, walking to go to the bathroom, anytime you're moving your body. Where exercise is a little bit more focused or planned or structured. And that includes things like the traditional sense of doing like cardio on a treadmill or doing strength training. You're trying to improve upon some fitness aspect. So when we're talking about mental health, we just really want people to get moving. So whether that's through physical activity or exercise, there's so much that can help improve whatever the condition is, whether it's depression or anxiety. We know that movement can help stimulate some of the things that are going on in our body. So that would be including managing stress. That could be things like improving or increasing our hormone levels, like endorphins.
Mm-hmm.
It can be a positive way to learn how to cope in general. So lots of different things can contribute to mental health with exercise or movement.
Right. And so do you see a lot of, like in your clinical experience then, what are you mainly working with right now?
Yeah, so I would say mental health has always been there, but
Okay.
definitely with COVID, there's been an increase. Just people are having a hard time coping just in general with life. I think with life after COVID, there's been a lot of changes in people's lives, whether it's their work circumstances or just general. Often I find that people that have chronic disease, they have lots of struggles with their mental health as well. So lots can play into it. There's not just one avenue when it comes to mental health, but definitely it can cross across a lot of different aspects.
Oh, for sure. Yeah. And I mean, like you hit the nail on the head with COVID. It's both socially, physically, economically. Now we're seeing that impact. So it's played a big role. And you had, when we were talking before this, you had mentioned kind of what you went through during that time of COVID as while you were in primary care at that time?
So I was working in pulmonary rehab at the time when COVID hit, and we were told pretty much that we were shutting down. So we were redeployed to work in different avenues. So at the time, I was in a long-term healthcare facility, and so we were just told to do different tasks that we had not done before. So for myself, I was told to do visitor screening. So this was a position that didn't exist prior to COVID. I was given a clipboard and told, you're going to go up to every single person that comes through the door, making sure that they're being screened for various symptoms to make sure that they're safe to come into the facility.
Right.
So practically a brand new position.
And scary in itself, because you don't know
exactly.
what's really happening in the world, right? Like with what's
Totally. And every day was different. So you didn't know what you were walking into day to day. So I ended up going into doing staff screening as well. I was helping portering patients out to have smoke breaks. I was helping feed patients, just anything that they needed help with due to lack of staff. And it was challenging. You would come in, you didn't have any set, I guess, knowledge or maybe even expertise in the area that you were dealing with. Having my background in kinesiology and just doing exercise, I'm now being put in roles that maybe I didn't feel comfortable with or lacked control of what I was doing day to day. So it definitely played with my mental health as well.
For sure. And how did you find that you best coped with it at that time? Like everybody kind of, there were so many different ways to cope at that time because you couldn't see people. And how did you find?
It was a struggle for sure. And it's funny because a lot of people said that during COVID they didn't exercise as much because they couldn't access gyms, but I found myself gravitating to exercise. And I think that's just part of my background and my knowledge of knowing how it does impact people's mental health and their coping. So I did gravitate to exercising more. I did online apps and YouTube videos. So I definitely exercised a lot more. But my stress definitely increased just with that lack of control within my job. And like you said, that lack of isolation factors of being able to not see each other as often. I couldn't see my friends. There's just so many things that went into it that you didn't have control. And I think that was the biggest thing for me, is just not being able to know what I was doing day to day, and then going home and you didn't know what the restrictions were going to be like, what the government was going to impact on your livelihood or life. So it was definitely a challenging time, and I'm grateful that we're kind of coming through it now, but you can definitely see that we're not totally through it because people are still struggling with it.
Yeah, there's still, I'd say, the aftermath or the almost like a overall PTSD from everybody that
absolutely,
we're all trying to figure out what just did that just happen? Was that a real thing? And so you were in the cardio rehab or pulmonary at the time. How did you find that affected the families mental health wise? Like, we didn't know it was so deadly and all the reports that were coming out and stuff like that. It was just always so unknown. So how did you find it affected the families?
So like I mentioned, we kind of got shut down in terms of the pulmonary rehab. So we didn't have a lot of access to the patients anymore. They weren't coming in. But definitely in the long-term care facility, we had to deal with visitor screening, and it was a very stressful time because every day it was some new restriction or some new regulation that they were putting in. So the families were stressed. They were not happy. We had to get security at the doors to help manage unruly people that might have been frustrated or expressing their emotions in a not very nice way.
You put that very nicely.
Yes. We got yelled at quite often. People were frustrated and rightfully so, right? They wanted to see their loved ones and they wanted to be able to take care of them the way that they wanted to. And now all of a sudden we were telling them that they couldn't come in. They were restricted to certain lists. They might be limited to just one visitor for that patient. So definitely it was hard on the families. It was hard on the staff. It was hard on everybody all around.
Yeah. Thank goodness it's pretty much over. We're seeing, like you said, other things. And so leading into that, can you kind of go through a day of what you do on the daily basis?
Yeah, prior to COVID?
Or either one.
Sure. So
and how much, did it change prior to and now?
Yeah, I can kind of walk you through kind of the various stages that we've gone through. So when I was in pulmonary rehab, it's a group exercise program and education class. So the way that it would work is people would come in either 2 times a week or 3 times a week for a set number of weeks. So depending on the number that you chose. So if you came in twice a week, you would do 8 weeks of the program. If you did the 3 times a week, you would come in for 6 weeks of the program.
Okay.
And you would do a mixture of exercise, in terms of treadmill, bikes, and then we would have some strength training exercises that they would do either using dumbbells or using machines.
Right.
So in order to get started in the program, they would initially be assessed by a pulmonologist. And then I was working as a therapy assistant at the time, and then we also had respiratory therapists. So that was kind of our team. We also had one physiotherapist. So us as a team would assess the person doing a CPET is what we would call it. So a cardiopulmonary exercise test. We would do a 6-minute walk test, and then we would do a couple of other assessments in terms of sit to stand. So looking at their lower body function, grip strength test, looking at their upper body function and strength, and then some mobility or range of motion testing. So they would go through all of that before they were admitted into the program. If everything deemed safe for them to continue, then they would come into the program and do exercise. So my role was to really assist with the testing as well as with the exercise portion of the group. And for that, I would just make sure that people were using the equipment appropriately, making sure that they were safe, that they weren't doing anything crazy, using appropriate weight. And so that was pretty much the program before COVID.
Okay.
When COVID hit, we had to kind of pivot. So as I mentioned, we kind of got shut down as things started to come back, I guess, in terms of restrictions. Things changed it again. But during the reopening, I guess, of our clinic, we started to pivot into virtual rehab. So instead of having people in person, we are now doing everything online through Zoom.
Totally different dynamic.
Very different.
Some probably loved it, and some
So some really good things that came out of COVID, I guess, was it really helped with the accessibility of programming. So being able to reach those that maybe didn't have modes of transportation to get to our program, people that were maybe less mobile in order to get there. So that really helped with programming. But it was very much a different program from in person, seeing people interacting. You didn't have as much of a social connection. So while it did help because a lot of them were at home isolated for the most part during COVID, it did give them a little bit more of socialization by attending the program. It still wasn't to the same capacity as before COVID.
Right. So did you notice different relationships with newer patients that came in then?
Yeah, you didn't really get to know the patient as well. It was pretty much you just did the program, you showed the exercises. You didn't get to have those one-on-one conversations with them. You didn't get to understand a little bit more of their background. Usually when we were in a group setting, we could kind of have those one-off conversations, get to know people a little bit more, even learn about their background, right? So during those times, people would divulge a lot of personal information in terms of if they are struggling financially and how we could maybe help meet that need, or if they were struggling with their mental health, or maybe their home life wasn't good. So we were able to support them from that perspective as well in the program beyond just doing the exercise portion. So you really missed out on that when it did turn to that virtual format.
And I do think that's, what we noted, like I noticed that myself the most is just how maybe you don't feel safe or trust a practitioner as much. I had online therapy, and I was lucky enough that my therapist, I knew her before.
Oh, awesome.
Right. But if you were just going into it, your level of trust might not be quite the same.
Yeah. Exactly.
Yeah.
So that kind of evolved as I switched into different clinics as well. So going into cardiac rehab, we did a lot more phone calls with patients. We did a lot more just talking versus maybe doing actual rehab per se. So very different ways of dealing with things virtually, even between clinics. And then primary care, we've kind of just stuck with whatever works best for the patient now, which is nice because, again, it can eliminate some of those barriers. But we haven't got rid of the virtual component yet. And I think it's here to stay. Yeah. So Zoom, phone call, whatever works best for them.
Well, that's kind of nice because, there are some people that actually prefer not to, socialize as much, and that's fair too.
Totally.
So if they have any anxiety about going out or anything like that, at least you can provide that for them.
Yeah.
Now, In relation to pain
Mhm.
and I know the physiotherapy side of things, obviously that's a huge impact on your mental health. Can you kind of give a little bit more about that?
Absolutely. So one thing I do want to clarify is that physiotherapists and kinesiologists are separate
Right.
fields. So kinesiologists have a 4-year bachelor's degree in kinesiology. And then physiotherapists, they do get a 2-year master on top of that. So a little bit of a distinction between the two, because I know a lot of people do get confused between the two fields, is that physiotherapists, they use a lot more manual therapy. So they might be digging into your muscles, they might be manipulating the joint. They also use therapies like ultrasound, TENS machines, acupuncture. So those are things that as a kinesiologist I wouldn't use. I use just more of the exercise. But in terms of the pain management, definitely that can play into how we feel and vice versa. So a lot of the patients that I do deal with, like I said, have chronic disease, and pain is a big component of that. So when you do have pain, a lot of people don't want to move. So trying to convince them to move can be a struggle. But then you get kind of stuck in this cyclical pattern of you're in pain, you don't want to move. So then you don't move. So then you end up losing your strength, you lose your functional mobility. It gets harder to do your activities of daily living. So it really does kind of go back to that pattern. Then you're in pain because you're not moving, you can't do as much. And it just kind of goes around and around, right? So that can play a big part on your mental health as well, right? You're not where you want to be, you're not able to do the activities you want. So then people tend to end up going down in a spiraling effect with their mental health, right? They're not where they want to be. They have to now rely on others. They have to ask for help. And that's really hard for some people. They don't want to ask other people for help. They want to be able to maintain their independence, and pain sometimes can affect that.
Oh, for sure. I just recently hurt my back, and yeah, I can attest to this. I don't normally. I'm not depilit. What's the word I'm trying to say?
Debilitated.
Yes, to this extent. But yeah, wow, like to lose that feeling of independence as well.
Yeah.
And then, of course, if you're somebody possibly that's always been active, and say you have a sports injury, or right. Yeah, that would definitely play on your mental health. So to see somebody when you first start working with them to the time kind of as they're healing and getting to the end stage of things, or better anyways, what's the big thing that you notice about the change in them? Like, do you see a huge change?
Oh, definitely. And I think it depends on, I guess, the condition or what their goals were and the amount of work that they put into it themselves. But definitely with any sort of group program that I've been a part of, whether it's pulmonary rehab, cardiac rehab, I've done a lot of osteoarthritis classes, any of those types of conditions, people are, I would say for the most part, happy that they went through the process, that they did the rehab. They notice changes in terms of talking to pulmonary rehab. They would notice changes in their breathing. They're able to breathe a little bit better. They've improved in their endurance. When it comes to osteoarthritis, they find that they're not in as much pain. They're able to manage it a little bit better. But across the board, I would say people feel better able to manage whatever condition they have. They feel that they have a sense of control of their life. They feel that they are able to maintain their independence, which I think is a big thing. So the other big thing is they feel that they've improved their quality of life overall. So I think that's pretty cool to watch.
Oh, for sure, to see that growth and the change. So maybe this is totally off topic, but for pulmonary rehab and with respiratory and all that stuff, do you find like anxiety plays a huge role in breathing anxiety, you know what I mean? So do you find, again, how does that kind of correlate together?
Yeah, so when people can't breathe, they get panicked, they get anxious, which then causes them to hyperventilate, which means that they can't catch their breath.
Right.
So then they're again in this cyclical pattern and they can't get out of I can't breathe, right? And panicking. So we teach techniques on how to cope with that and deal with that, right? When you notice that you're getting panicked, okay, let's try and slow that breathing down. Let's work on our breath work. Let's take nice slow breaths. Can you sit down? Can you remove yourself from the situation that might be causing that anxiety? So for some people, it can be walking, right? So walking in the mall could be stressful, just because they have a certain distance that they have to go. There's lots of people around. So sometimes it's, can you manage to find a bench and just sit down and focus on your breathing?
Right.
So one technique, especially for people that have COPD, we would call diaphragmatic breathing.
Okay.
So basically, you're just sitting in a chair, you're focusing on taking a nice deep breath in, your stomach will go out as you breathe in, and then you're letting that air out through what we would call pursed lips. So breathing out nice and slow, the stomach will then come back to that starting position. And we would get them to do that a couple of times just to slow down their breathing and hopefully reduce some of the anxiety that they're feeling when they can't catch their breath.
Right. So do you, as far as practical strategies for patients that of all, for exercising, and is there any kind of tips or strategies that you can suggest?
Yeah. So the best thing is just to move and to move regularly. And with that, I would say find enjoyable activities. So not everyone's going to enjoy the same activity as each other. So finding something that you really can tolerate. And I say tolerate because sometimes people just hate moving. So whatever you feel that you can tolerate and do regularly. So maybe that's just starting off by walking for 1 or 2 minutes every couple of hours, just breaking up that sedentary time. So sedentary just meaning being in that seated position or not moving very often.
So, and I know you had mentioned, taking the stairs instead of the elevator, things like that.
Yeah, exactly. So there's ways that you can add movement into your day that aren't complicated, that aren't going to take a lot of time to do. So taking the stairs is one great example to get movement in. You can think about doing activities as you're doing other things that are a part of your day. So brushing your teeth, maybe you want to do 10 calf raises while you're doing that. Maybe as the water is boiling for dinner, you can get in 10 squats. So there's times in our lives where we're waiting for things that we could actually put movement in. So there's not really a time limit on moving. The one thing I would say is if you're working towards improving your cardiovascular health, trying to move for that 10 minutes as a minimum.
Yep.
And then increasing from there. But when we're talking about strength training, we are really focused on the number of repetitions and the sets that we're doing. So you can fit that in wherever.
Yeah, it doesn't have to all be in 1 hour.
Yeah, exactly.
Throughout your day, except for, like you said, if you want to raise that.
Yeah,
your cardio.
Yeah, exactly. So there's a lot of misconceptions around movement and exercise. And so when we're talking about that, it doesn't have to be 1 hour in duration. You can do it in smaller chunks. 10 minutes here and there can also accumulate to the total. So there are 24-hour movement guidelines that recommend how much we should be getting per week in terms of movement or exercise. So they focus on 150 minutes of aerobic types of exercise. So that would be things like walking, biking, swimming, or anything else that you could really do for a sustained period of time.
Yeah.
And then doing strength training for 2 to 3 times per week. So when we're talking strength training, that's just using anything that's going to put stress on the muscles and joints. So using things like resistance bands, your body weight, machines, anything else really that you could think of.
Is there certain exercises for arthritis and for pain management that you suggest? Is it like, because you think I'm in pain, how do I do this?
Totally.
Yeah.
So when it comes to pain management, it's really working within your own thresholds. So when we talk about pain, we usually tell people to think about a scale of 0 to 10. So 0 would be no pain or discomfort. 10 would be kind of that excruciating pain. And we want to try and keep the pain in the middle of the scale, so 5 or less on that. And then really it's whatever you feel you can do. So that might be doing stretching. Maybe that's just kind of doing a 1-minute walk here and there. Maybe it's just you're going to focus on doing something, not even daily, maybe twice a week. is going to be your goal to start, and just really seeing what your body will allow you to do.
Right.
Some people gravitate more towards yoga because they find that's a little bit easier. For pain, I often recommend what we call non-weight bearing exercise. So things like getting on a bike so that you don't have to carry your whole body weight when you're doing that, or doing aqua or water-based activities. The buoyancy of the water is going to help alleviate some of your body weight that you have to carry. So that's sometimes a little bit easier on the joints as well.
And it's fun.
It is fun. I love the water, but I have come across a lot of people that don't enjoy the water. I can definitely appreciate both sides.
Yeah, for sure.
But you can also do movement in a chair. So a lot of people get stuck that exercise or moving regularly has to be done at a gym. And it's not true. You can do it at home. You can use YouTube videos. I found a lot of good resources in terms of chair-based exercise. So even thinking about marching in a chair, right? It's going to be a little bit easier than doing it from a standing position, but it's going to work your heart, your muscles, all the same.
Right. And it's actually probably using different muscles than you would if you were standing anyway.
Yeah.
Right?
Yeah. There's going to be different movements, different muscles that are going to be working. So you might not notice as much in terms of the different positions for some people. I can say that when I was doing some chair-based exercises, I definitely noticed my hips a lot more.
Okay.
So definitely doing things like marching, I could feel it in my hips. Just when I'm marching on the spot standing, I'm not engaging my hips as much. So that would be one difference just from the two different positions.
So when you were training, when you were in school for kinesiology, was there somewhere, like what really got you excited about the field?
I've always wanted to be in healthcare. I think ever since I was a young kid. And so I've always been drawn to the helping profession. And I really thought I would go into nursing. And then as I started to see what nursing is in a hospital setting, I realized, nope, that's not for me. I don't want to deal with bodily fluids. I don't want to deal with all of the things that the nurses have to go through. Now, being said, nursing is a lot more than just being in an acute care setting. And I didn't really know that at the time, but I kind of pivoted and said, what else can I do within the helping profession, within healthcare? And started to explore other options. So I really wanted to go into physiotherapy. And when I got there, I realized it's a master's degree. So I had to pick an undergraduate degree first before I could get into physio. So I decided, well, if I want to get into physio, I might as well go into an area where I'm studying the body. So kinesiology was kind of that first step for me. So getting to know a little bit more about the background about the body, I felt would help me get into physio. Once I got into kinesiology, I realized just how competitive physio is, and I just didn't have the grades to get in.
It's very competitive.
It's very competitive to get in and very hard. And like I said, I just didn't have the grades, which honestly, I'm kind of thankful for, because now looking at it, I was like, I go back and forth a lot of, should I go back and upgrade and go into physio? But I think I am where I'm meant to be. I really like doing more of working people in terms of behavior change, working on their goals, getting them to where they want to be. And I just feel that physios don't necessarily have the time to spend a whole hour with someone diving into where they're at in terms of their behavior and helping them with that education. They're very busy, either in the acute setting or in the community setting. So it's very different.
More of a personal level, I would think. I know for myself, when I was working from home, I do sometimes I'm at work, I found just even getting outside and walking to my mailbox or standing outside for a little bit, take my dog, for a short walk, something like that, makes a huge difference.
Totally.
What can you recommend to somebody who's maybe more isolated that way?
Yeah. So with working from home, it does make it a little bit harder because when you are in the workplace, you tend to have those more frequent times where you get up and move, right? You're going to fill up your water bottle. You're going to visit with a coworker or talk to them about something.
Mhm.
You have meetings, maybe you're walking to the boardroom. So there's a lot more movement just within an office setting in general. So when people started to move to work from home, they started to be a lot more sedentary. They started working through lunches, they maybe started working later throughout the day. And I would just challenge you a little bit to get up and move. So we do know that movement and exercise helps with our focus, our concentration. It helps with our creativity. So you might actually notice that if you step away from your computer, you step away from your meetings, you might notice a change in actually your productivity from just stepping out, walking for a few minutes, maybe doing the stairs,
Mhm.
getting outside. There's a lot of research that's starting to focus on nature, being outside, and how that can improve our mood and our mental state. And I think a lot of it has to do with getting away from technology as well, in
Yes.
terms of our phones and our screens, and just focusing on our wellness.
For sure. What now? Can you tell us a few things that you like to like? Are you yoga based? Have you tried meditation? Are you kind of into any of that stuff as well, or wellness activities in general?
Yeah. So I've kind of done a little bit of everything. So my exercise changes just kind of depends on my goals and what I want to achieve. So I used to always do group fitness classes. So I'd go to the gym traditionally before COVID. And then with the shift in COVID, I started doing at home just YouTube or fitness-based apps. And then over the summer, I have a couple of friends that are really into running. So I mentioned that I'd like to get better at running, and so we started meeting up and running once a week, and then that progressed into doing it 2 to 3 times a week. And then I ended up running my first 5K at the end of September. So really fun to just have that social aspect with my friends and be able to achieve a goal. I got back into the pool recently and started swimming laps. So that's something I haven't done in a long time,
Yeah.
which is kind of fun. But yeah, my activity from that standpoint, it's very, very changes with the season sort of thing, based on what I have interest in and what I want to achieve. From more of a wellness standpoint, I have faith, so I'm a Christian, and I do believe in prayer and doing devotionals. So during COVID, I got really into the practice of reading a devotional and then writing down based on the questions that prompted it. So I think for me, that's a sense of, I guess, meditation in a sense, if you want to call it that. I've also done guided meditations through YouTube. So I found a Christian-based one where they talk a lot about God and Jesus and just really listening to what they're talking through and just being present in the moment.
Yeah, exactly. It's all about being present, right? Anytime you're, those mindful activities and those.
Yeah.
So, something that I usually ask everybody is, what is the last best thing that you do at the end of your day to end it just right?
Yeah, that's a hard one.
Yeah.
It really depends on the day. So some days so I was mentioning earlier that I have kind of a routine when I go home. So my routine kind of before bed is I'll watch a little bit of TV and then I'll get ready. So I'll shower and brush my teeth. And so sometimes I'll read my Bible and pray, and that's kind of how I end off my day. And sometimes I'll watch kind of fun videos with my husband. He always has something that he wants to show, either a funny animal video or something that gets me laughing and upbeat. So I think that's kind of a fun way to end the day as well.
On a good note.
Yeah.
That's awesome. So do you have any pain strategies, anything to help with pain management that you can, any advice you can give?
Yeah, so it's going to depend on each person as to what they feel that they can tolerate. So I would just say find an activity that you feel that you can do and enjoy, or at least tolerate. So everyone's pain threshold is going to be different. Pain is very complex in terms of how it's interpreted. So often there's a stimulus and then it's interpreted by our spinal cord, and then that travels to our brain is where it's interpreted. So each person's going to be different in terms of how their brain is interpreting that signal. So some people, they're always in pain. They just have chronic pain, and they can't, they don't know a lot of strategies in order to shut that interpretation off. So we do try and think about, okay, well, how can we hardwire it differently, right? So that you're not constantly getting that stimulus. And one of the things that we talk about is actually that our mood can affect pain. So when you're feeling sad or depressed or angry, that can actually flare up your pain. So trying to find ways to actually cope with whatever is triggering you can be helpful. So maybe that's watching something funny to kind of change your mood. When you're in a better headspace, you're more able to kind of deal with your pain. Moving often is something that is always going to be at the forefront of my brain in terms of getting people coping better. When you're able to move, you have better function, you're better able to cope with what you have to do in a day. The other thing is thinking about your food. So that's not my area of expertise, but even thinking about, is there foods that are maybe less inflammatory than others? Could you start doing other practices that could help from a nutrition perspective? Maybe that's switching out what you're drinking in terms of pop, just in terms of healthy lifestyle. We recommend stress management. So reducing the amount of stress you're associated with, making sure that you get a good quality of sleep. And that's really hard when you're in pain. So sometimes it might even be going to speak with your doctor and getting some pain medication, just so that you can get some relief and get that sleep in. So sleep is really important for recovery. And if you're not sleeping well, you're not necessarily getting that recovery.
So is that something then you would, with practically speaking with different practitioners within where you're at? Is it therapists? Is it the traditional like nutritionists and all that stuff together, kind of?
Yeah. So where I'm at in primary care, we have access to lots of different team members and disciplines. So we're quite fortunate. We have nurses, we have pharmacists, we have dietitians, we have behavioral health consultants, which deal with more of that short-term mental health support, and then exercise teams. So lots of different people that we can kind of rely on and work with for various conditions. So I know for a chronic condition like diabetes, they might actually see the whole team. So they might see the pharmacist to help with their medication management. They might see the nurse just to help kind of track their blood levels or any of their labs that they have. They might work with a dietitian to talk about ways of managing their nutrition. They might speak with the exercise team just to get some more ideas in terms of how to increase their physical activity. So lots of different people there to support. Sometimes it can be overwhelming with the amount of suggestions or help, but our goal is to just give you the best care you can and give you tools for your tool belt, essentially, that you can draw from in order to manage your condition.
And the more choices, I mean, you can draw from more, you can't.
Exactly.
If they're not available. So the mental health, you said it can be a short time. It's more of a shorter duration of mental health care. Now, is there a program that you can kind of guide them towards if they really are struggling with that end of things?
Yeah, so for depression or anxiety or any sort of other mental health, I would just see them from an exercise or a physical activity perspective. So that's where my expertise or focus would come in. But if they're finding that they're struggling, I've had people come into the office and they're just crying and they can't stop crying. And so I kind of take a step back and say, like, maybe this isn't the right time to be speaking with me. Maybe you need to cope with some of the other life stresses that you have, and get that better managed before we have a conversation. And so I would refer to our behavioral health consultants, and they're kind of the gatekeeper for a lot of different things. So they might recommend certain classes for the patient to talk about strategies for coping.
Mm-hmm.
They might actually refer to a mental health practitioner that we have access to, or they might refer to the community in terms of getting situated with like a psychologist or a psychiatrist.
Good. It sounds like a very supportive team.
Yes, very.
Yeah. And that's what I think the reason why I started this is to get that out there, that it isn't impossible to get the help you need,
Yep.
whether it be for pain, for psychological, it is available. It's just a matter of seeking it out. And so is it something then you are referred by a doctor?
Yes. So for us, you're typically referred from your physician's office. And then you could be referred by one of the multidisciplinary staff. So for example, if your doctor referred you to see the dietitian for diabetes, once you're kind of in the door, then you have access to all of us. So from there, if the dietitian felt that it was necessary, they might do an internal referral to see me or any of the other providers on the team. So typically the first step is the doctor, but then it can get passed along depending on the discipline.
Right. Awesome.
Yeah. The one other thing I would mention is that it is a free service. So
okay.
A lot of people get worried that they're getting referred to something that they have to pay for, especially if finances are a concern. There are kinesiologists in the community that often do charge for a fee for their service. But in primary care, we are covered through Alberta Healthcare. So it's nice to know that it is a free service for people to use and that they can get the care and help that they need.
It's the option. Yeah. And that there are people there that care.
Yes, exactly.
It could, because that is often, and I say this all the time, especially with mental health, it's something that, it's not always, it feels so unattainable.
Yep.
Therapy costs a lot of money and a lot of these, even your medications and stuff. So if there are those other options that you can, at least that can subsidize something else.
Exactly.
Right.
And people often feel so alone, right? They feel that they're very isolated. So even being able to get connected with providers that care and are there to listen, right? And sometimes that is my job when people do come in with mental health concerns, is just giving them the space to tell their story and being another set of ears to them to kind of guide them where they need to be.
Right. And that's the trust, when you have that one-on-one,
absolutely,
personal, it, like you said, not every, not everything is going to be the right fit for you or every person, but if you can, it might be just that one person that you really click with, and you might just make their day.
For sure.
Right. And vice versa.
Exactly.
Right.
Yeah.
This has been so wonderful, and I thank you. We had a few glitches here and there, but that's okay. Always something to look always something that comes up with these, and that's what I love about it. Yes. So thank you so much for taking the time, and really, it is another area that people really, I think, need to know more about, and how it actually can affect your mental health. And this has been a really important one for people to hear, I think.
Awesome. Well, I'm so glad I was able to talk today. And I agree. I think it's an important area that needs more work in terms of just knowing what we do and how we can be there to support. So I'm glad that kinesiologists are getting more recognition, and I hope to continue to spread that information of what we can do and how we can help.
Yeah, that's amazing.
Thanks so much.
Thank you, Jess. Next, so this was, you can find me on Instagram at carryonwithcarrie_podcast, and on Facebook at carryonwithcarrie podcast. I will see you again next Thursday. I will have Jess's links up for her social media. Again, she's with primary care. So if there's any questions about how to get hooked up with any of that, we can give you the links. Thank you again, and I hope you enjoy the rest of your week.